improve child development and reduce cost to society. And we even have evidence that these programs and approaches can eventually increase the children's economic security when they're adults by improving their employability and improving their relationships with others. So our hosts today, and we have three, all work on identifying and implementing evidence-based policies and solutions for child poverty. And when I tell you a little bit about our three hosts, you'll see why they felt it was important to have this briefing. The first host is the National Prevention Science Coalition. And it's composed of scientists, educators, practitioners, clinicians, policymakers, foundation representatives, and some affiliated organizations. They share a common goal, and actually we have a couple of slides about them, so I'll show you those. They share a common goal to prevent social ills and promote well-being by translating scientific knowledge into effective and sustainable practices, systems, and policies to improve the lives of children, adolescents, their families, and communities. In particular, they promote governmental adoption of a prevention model, which both reduces expenditures and benefits society through congressional briefings, policy papers, op-eds, and fact sheets for the public and private sectors. Its members work in a nonpartisan manner with congressional offices and caucuses, and they collaborate with like-minded groups and federal agencies. Our second sponsor, which is actually listed third on the sheet, is the Edna Bennett Pierce Prevention Research Center. It focuses on longitudinal and developmental research on risk. The center research examines how communities can work together with families, schools, community groups, and industry to promote healthy lifestyles for children, youth, and families. It also develops clinical trials of innovative models to promote competence and prevent maladaptive outcomes for children, families, and communities. Their research includes emerging adulthood, family science and intervention, a program on empathy awareness and compassion in education, school-based prevention research, training, and dissemination and implementation. If our first two sponsors focus on identifying and promulgating scientifically validated programs that can improve the lives of children and families, our third sponsor, First Focus, is dedicated to getting those programs adopted at the federal level. First Focus is a nonpartisan advocacy organization dedicated to making children and families the priority in federal policy and budget decisions. They have a comprehensive advocacy strategy with hands-on experience with federal policymaking and a commitment to seeking policy solutions. First Focus moves beyond individual issues to serve a more important role as children's advocates overall. I also want to introduce you for a moment to the organization that I work for, which is the Partnership for America's Children. Our organization does our members do at the state and local level what Bruce's organization First Focus does at the federal level. We have 52 members in 41 states that advocate for better policies for children and families. And our members are multi-issue, independent, nonpartisan, nonprofit. They work specifically on using evidence-based research and data and analysis in order to improve the lives of children and families. So, as you can see here, what we've got is a group of organizations that all believe that it's important to use evidence-based strategies and that we have a number of them that work to improve the lives of children and families.